Hello, I'm Dr. Diane Tucker, and I'm one of the psychologists with the Supportive Care Clinic at UAB. I'm very pleased today to welcome Beth Curry to talk with us, and we are part of the Psychosocial Oncology Training Academy and have as a goal to help mental health professionals and primary care physicians be able to more effectively work with breast cancer survivors. Okay, so as I said, I'd like to welcome Beth Curry. And Beth, if you could talk a little bit about your experience with breast cancer and what that journey has been like for you.
Sure. So I was originally diagnosed about 8 years ago with my first breast cancer. It was caught on a routine mammogram. Surprised me tremendously. Sort of have a self-image of being healthy. Sort of shook my world, but things went very well. I went through 4 rounds of chemotherapy and radiation, had a lumpectomy, and was sort of told everything looks great. Then about 4.5 years later, was playing golf actually, and had almost gotten to the place that I didn't think of myself as somebody who had had cancer. And I'm not a great golfer. I hit the ground and my shoulder just reverberated with pain. And we ended up going to an orthopedic sort of doctor who thought it was a sports type injury, and ended up discovering something on the x-rays that made him suspicious, and thus began quite a bit of diagnostic work that determined I'd had some metastasis to my right shoulder. Absolutely shook my world. Very scary. Had some palliative radiation to my right shoulder at that point in time just to relieve the pain, and then transferred my care, although I'd had great care, transferred my care from a local hospital to UAB, sort of feeling like I had, goodness, if I was in the group that had metastasis, I wanted to be at the cancer center. Began on an oral medication and some bone health medication and a estrogen suppressor, and had good scans, and I was feeling very positive about how things were going until actually just a few weeks ago. Had a routine every 6-month scan, and more metastasis was discovered to 2 of my vertebrae. And so we've changed medication regimes, and I'm getting used to the idea of a second metastasis. Very thankful that I, at this time, don't have any activity in any of my organs, but sort of live with that fear, I guess I would say.
You used the phrase a couple of times, it shook my world. First about the idea that you could have breast cancer at all, but then about also the realization that it had metastasized.
Yeah, so when I went in for the first, when I very first was diagnosed and went in for the first biopsy, I had seen the surgeon who did the biopsy the day before, and he had rather confidently said, I do not think we're looking at cancer, but we've got to chase this. And so I went into the biopsy with feeling like I was doing the right thing and was pretty hopeful. And my spouse was in the waiting area, and when he did the biopsy, I will never forget this moment. He looked at me with the most loving face and said, "I am so sorry, I do not like what I have just hit." It was his words. And he said, I know I told you yesterday I didn't think this was cancerous, but I do. And I lay there in this tiny sterile room with just him and the nurse. I remember tears trickling down my cheek thinking, I've got to get out of this room. Very much I was rather ignorant, truthfully, about breast cancer in terms of it being such a multifaceted name, that there are gazillions of degrees, and I really didn't know very much. I just sort of had a quick sense of, oh no. Walked out and looked at my partner across the way and just broke into tears and left the room. Left and went outside, and then began to learn quite a bit about the hope that is involved with breast cancer. I remember my first oncologist saying to me, I think it was Betty Ford, I'm gonna be embarrassed if it wasn't, but be thankful. She was not trivializing at all, but she basically said, be thankful that you have breast cancer and not, and I don't remember what her example was, but it was, we know a lot about breast cancer. It has been studied a lot, and we have things we can do. So don't feel as if this is a death sentence. This is a chronic health condition. And I calmed, and then began doing a lot of reading. Was, I think, very appropriately told, at least for me. I was given a couple of very reputable resources and cautioned to not get on the internet chasing rabbits, and that was really good advice for me. That, here are some resources that we trust and we feel good about. Feel free to, you're your own patient. Learn what you want to learn, but don't. There's also a lot of not so helpful things out there, things that will scare you. That was, it might have been from a co-survivor. It might have been from a co-survivor, but it might have been from the oncologist who said, here are two good resources. Sort of limit yourself.
Connect with a co-survivor?
It was just a friend. It was just a friend. I came to learn, I was amazed. It's sort of like when you buy a new car and you thought you've never seen that car before, and then all of a sudden you see it everywhere. It seemed as if everywhere I went, I would, if my breast cancer came up, it seemed almost like every other person said, oh, I'm a breast cancer survivor. And it gave me a great sense of, oh goodness, there's this woman in my Sunday school class that has been a survivor for 20 years. There's this woman I work with I didn't know had breast cancer who, it was a very, it became a much less scary label, I guess. But when the shoulder issue came up, it was a much scarier, it's a much scarier situation. I felt like, oh goodness, if it has gone to my shoulder, where else are these little bad boys? And really sort of got the analogy from one of the things that I was reading that was sort of, there are these, little bad cells running all around, and if they can congregate enough and set up camp somewhere, that's kind of what metastasis is. And it was like, oh, if you've set up a bonfire in my right shoulder, where else are you going to pitch your tent? And it was very scary.
I feel like you really probably don't have much control.
No, very much not. Was somewhat where I'd become confident, all of a sudden I became numb and I felt victimized. I felt like I was
victimized.
That's not really the right word.
Well, I think I'm hearing that the sense of momentum you had developed after getting through the first piece.
Sort of had my feet taken out from
under you.
I had it's interesting, the fact that this was it was a sports medicine doctor who discovered it, and he was very, he was so kind. He was, I ended up writing him a thank you note at some point in time because of the way I've seen him for various various joints through life. I mean, he's somebody who's familiar to me. And I would not imagine that his daily life includes having to tell somebody they may have metastatic cancer. And he was very tender.
Sounds like that meant something special to you.
It really did. And I had forgotten about, I've been thinking in preparation for today about sort of who did things that helped my heart rate come back down a little bit, and he really did. But getting a metastatic diagnosis was very much more like panic ensued, and I definitely have to work to keep in the moment instead of, oh goodness, is this going to be my last, whatever, my last Christmas, my last birthday, my last time I see this person. And that's hard. Whereas I didn't feel that way so much with the first diagnosis. I did initially, but it dissipated quickly. And now over the last few years, it's been much more top of mind.
And probably especially the last few weeks.
Oh, very much, yeah. Because I got a sense of, okay, we got this thing, and we don't have this thing.
How has it changed the way you think about yourself? Your family?
Yeah. I have always had a sense of being a very capable person, just a very capable person, and not really had to go through my limitations before I consider something. And the side effects of some of the meds very much have me so that I sort of think, well, do I really want to get down on the floor right now? Because it's not real easy getting down and up because of joint pain, for instance. And
that is a change for you.
That is very much a change. Very much a change. Very active person, gardener, sort of as much as you can be at 60, athletic, singing. But also, I was sort of a driver, I think. Push through. You can, and I'm thankful that I have, because I think it is what's best. But I have had to learn, when you're tired, it's okay to take a nap. And I now have actually even come to sort of, all of my friends know there's a window of time. They probably ought not call me because I will maybe napping. I decided to retire earlier than I had initially intended, and that was really a whole lot of mental assessment, I guess, of if your time on earth is limited, how do you want to spend that time? And when I'm my best, I think I'm very much more aware of and appreciative of simple things, kindnesses. When I'm my worst, I've gotten too far ahead, thinking, what if?
So it sounds like there's a contrast between being able to be present and, as you said, appreciate the kindnesses, be in the time that you have, and that kind of recentering is helpful.
Yeah, it is, and it is not oh good, it's 9 a.m., I've recentered and all will be well for the day. It's all day long. But yes, it is. It's not just helpful, it's imperative.
What have been things that, in terms of the healthcare professionals that you have worked with, what have been the things that have been helpful? What have been things that have gotten in the way?
I'm somebody who does want to understand and know what's going on. So when people have taken the time to explain what my options are, but I'm also I trust the healthcare system pretty much. I know it's not infallible by any means, but I do care what my physician's recommendation is, but I want to understand why. So when they have taken the time, instead of just having I know better than you do, here's what we'll be doing next, that means a tremendous amount to me. I'll tell you a bad story and a good story, I guess. I mentioned earlier the side effects of the hormone suppressors, and initially my treatment was a drug called Ibrance and letrozole. But after I had this was the first metastasis diagnosis, after I had a few positive scans, positive meaning good, I began thinking, okay, I need to sort of understand my body. People talk about adjusting to a new normal. I think that's a little overused at times, but yeah, we will. I wanted really to discuss some of the side effects of the meds and whether there were additional things that I could be doing or that could be done that would help in that. And it was right after a quarterly or 6-month scan that had very positive results, and I kind of got up the courage to say, well, let's, can we talk about this joint pain and this fatigue? And I was frankly very quickly dismissed. It was, do you not understand? You just had great scan results. You just suck it up. You need to deal with it. And I was angry. I was hurt. I was diminished. Felt like I absolutely wasn't being seen. And it had taken a little bit of courage to ask, because I was thankful. But I do have enough understanding of people and myself and just well-being to know, by dang it, I had the right to ask, and it's probably good I was able to muster up a little anger instead of just being defeated. But I can imagine that if I had a different makeup, my first place would have been to be defeated, and that could be incredibly depressing.
Because you were having side effects that were troubling enough for you.
Very much.
That you really wanted to see what the trade-off was, it sounds like.
Mm-hmm. I wasn't at a place of, like, I know people sometimes, and I may get to a place of saying I want to discontinue this because the trade-off's not worth it. I wasn't there, but I was, goodness gracious, this is hard. And it's not the cancer that's hard, it's the medicine. So that would be a bad story. A good story is after, it was before this most recent metastasis, I think enough time had passed that I was getting to a place of saying, okay, this is my new normal. I think think I had just retired or was contemplating retirement and sort of giving up that sense of my identity.
Which is not trivial.
No. And my daughter was pregnant with my first grandchild. And I was having a whole lot of trouble. I was weepy often. I was, worried about whether I would ever meet my grandchild. I was wondering how I would deal with retirement and, what would I do with my time. And I went into a doctor's visit, also had good reports, and this happened to be a nurse practitioner, I think, at the time, and I had a very academic presentation of it for her. I had sort of gone through my, I'd like to talk to you about this, this, and this, and that may have been a byproduct of having been blown off before, I'm not sure, but right as I started into my academic set of questions, I just started crying. And she had been facing her computer, putting in some data, and she immediately stopped what she was doing, swiveled her chair, and put her hand on my knee and said, "Let's talk." And the contrast to how I was feeling really mattered, and that this was a balancing this whole living with cancer and treating it as a chronic health condition and dealing with the side effects and emotional strains and worries was just as important as whether the IRANS was working. And I was so relieved. She got tearful even, made some recommendations, and I got hooked up with someone to talk with about sort of how I was feeling and some coping mechanisms. And
so you found there were resources to help with the coping, some counseling resources.
Yes, specifically through I don't know its proper name, you can tell me, the supportive care. Yeah. And it also, knowing that what I was feeling was not, it wasn't like, oh, that's commonplace, let's check it off and move on, don't worry, you're normal. But I wasn't crazy. That it was, what I was struggling with was normal grief response, and it was very important, and was a part of the buffet of how are we going to live with cancer. Something that's been very helpful to me when I get myself into worrying, sort of, is this going to be the last time I do this, or could I start fantasizing about a trip 2 years from now, or is that too far out? Or she talked about thinking in terms of seasons. And so it's not just what am I going to do tomorrow, but what am I going to do this winter? How does the winter make me feel? What are the limitations that the weather brings? What are the possibilities that the weather brings? And then, what might be different that I want to consider in the spring? And that resonated with me very, very nicely, and it has been helpful to get a chunk of time that's not so big that I start worrying, but it's not so small that, my life is strictly, I'll go to the bathroom now, I'll pet my cat now, So it gave me chunks of time that were manageable, I guess I would say.
And plans and... You've used the phrase a couple of times, new normal, and you made the comment that's kind of overused. And I think I'd really appreciate it if you would talk more about that.
Yeah. I think there have been times when I felt as if either I wanted to or others wanted to reduce my disease process to being a linear thing, and I guess linear in this instance might be downhill, but and I hear the phrase, you need to accept your new normal or live into your new normal. And I think I spoke positively a minute ago about coming to learn that if I was tired, I needed to take a nap. And if somebody asked me to do something that I didn't feel like I was emotionally sort of in the right place to be able to do it, it was okay to say, not today. And so I think that's a good part of sort of accepting a new normal. But I do think that there's a little bit for me of, well, this is all there is. It's a negative. The new normal is this, and it includes this loss and that loss, and I think life's more dynamic than that. And
that's a really interesting insight. And it may have to do with the phrase we have of accept the new normal, as if you don't try to move it in a direction that's more consonant with who you are, but just, okay, well, this is all I've got, this is going to be it.
It seems stagnant instead of dynamic. And but I'll also, again, I'm repeating myself, but I do really think a part of my own mental health has been giving in a bit to, there's some things I can't control, and I need to understand how to respond to those in a way that's helpful. And so I guess that is accepting a new normal, because I was not a napper, and my naps are very important to me now.
So I'm hearing being kind to yourself and listening to what feels right at the time.
And another thing that's very important to me is surrounding myself and using my time with people I love and things that I care about. I got to a place, and it was probably a combination of retirement and cancer and sort of what is my place in this world. But I very much have gotten to a place of understanding I need to be actively involved in doing something for others. And it could be very small. Certainly during COVID, the manner in which I can, doesn't include going to an elementary school and tutoring, because I'm not going to be around. I'm not going to put myself in that environment. But being able to say yes to things that I think are helpful to others helps me get outside myself and not simply see myself as a needy person living with cancer. Not sure why I needed to say that, but I did.
I think a sense of a purpose and mission,
Yes.
From where you are is that's very important. And I think it is part of the challenge when life throws you curveballs to figure out, okay, how am I going to reconfigure my sense of meaning or purpose with where I am. If you think about talking with mental health professionals that are working with women that have are either in active treatment or are survivors of breast cancer, what are some of the things that you understand now, having gone through this experience, that maybe are important as a kind of premise to approach?
I think one is that I came to realize I was pretty ignorant about what breast cancer even is, that it's not one thing. And so I think it would seem that understanding where somebody is in that myriad of labels and what that might mean about how it's playing into their life, that seems like it would be important.
And probably there's two pieces of that. One is what the woman understands, and then if there's additional information that maybe hasn't
Yes.
come to be part of that.
Yeah, exactly. Another, I count myself as incredibly fortunate. Pre-breast cancer, I had had some experience with mental health counseling through some other personal issues, and really valued it, and learned a lot about myself, and learned a lot. So I had that, I think, as a positive tool for myself. I also have an incredibly wonderful family. I have a loving spouse. I have a great group of friends. I have a faith community. I'm not in financial distress. And it's still been really, really hard. And I don't know what the question is you asked me just a moment ago, but what mental health providers might need to know. I don't recall an oncologist or a primary care person doing what I would call a systematic assessment of that, of determining, how is this person's core well-being. And I think mine's pretty good. And I have a lot of resources and people who are there on those really yucky days to say, can I bring you a pot of soup? But I know that that's not always true. So I would think, I'm not a mental health professional, but I would certainly hope that it is a normal part of assessing sort of what is someone's core being, what are their resources, what are their options in their toolbox, and what has cancer maybe done to that. I had a few people who got really afraid of being around me initially, but I found myself having to educate some people about my cancer. That I wasn't going to be sad all the time, that we didn't have to talk about my cancer every time we got together. That if they had a prior experience with a family member that had gone a certain way, that's one of the ways things might go. And if it was positive, it didn't necessarily mean life was going to be positive for me. If it was negative, it didn't mean I was going to die next week. And so sort of learning who was comfortable to be around and who was comfortable being around me was important.
And I'm hearing you say that you are a unique person that has a lot of resources, both social and personal, and that is, you bring that wherever you go, but that the cancer experience has had an impact, and it has changed things. And so for a mental health professional working with someone for whom cancer is part of their background, I guess the expectation should be that has been a really high impact part of their lives that's likely to make a difference.
Absolutely. And certainly for me, the difference between the metastatic diagnosis and the first diagnosis was dramatic. And the need to almost daily assess what's important today. And that wasn't being overly dramatic.
But I hear it's effortful.
Yeah.
You talk about repeatedly focusing on being in the mental place that you want to be, but that takes ongoing effort to stay present and to stay, moving in a direction that you're wanting to.
It's interesting. It also affects how my first reaction to what other other issues or crises might be. There are times when it's tempting. I'll use COVID as an example, although I've been religiously attentive. But there's a little voice sometimes that comes up that go, oh, what the hell? You have metastatic cancer. And so there's a, I don't need to worry about that. And yeah, I do. Everyone does. And so that could be, substitute any other, COVID's been a pretty darn big crisis, but other things that are important decisions. It's like, well, it might become a little tempting to be cavalier or irresponsible, and I don't think that's a good response. You still gotta be in the game. If you want to get the love from a partner, you got to still be present and give the love to a partner, not. But on a bad day, you may go, wah. I have metastatic cancer, please treat me.
And something else I've heard you say is that the idea that there is a trajectory, whether it's always up or down, that has not been your experience, that it's kind of up and down and circling back around to a concern, and that because I think there's an idea that there should be a trajectory, a path through, and that's just not what I hear with people that are reflecting on their experience.
No, I hope, and I think I'm one of the people who has reiterated that. I see it as sort of cyclical, and that can be frustrating, because it's like, well, gosh, did I not learn that lesson yesterday? Why am I doing it again today? And that may just be life, but it very much, for me, and again, when I talk about the side effects of the medicine, much of what I struggle with or deal with on a daily basis is not directly that my cancer is causing a particular, me to feel a particular way or causing me a particular something. I think that the things that I deal with daily are more the side effects of the medicine. And, but I have good days and bad days. And so there's a little bit of a, do I feel good enough to play golf today? Yeah, I do. Or I think I'll skip this hole. or is today just kind of a stay in your pajamas day and watch television? And so I think that the lack of trajectory sometimes is, again, it's that self-care and that's awareness and trying to pay attention. But I don't feel the same way every day. And I usually get myself in a little bit of trouble when I ignore how I'm feeling.
Are there other things you wanted to add?
I don't think so, with the exception of I'm so glad this is happening, because I think that, again, I am fortunate and I live in a metropolitan area. I can imagine being much more secluded, or having, relying on a minister or a counselor somewhere who's trying to do the best they can, but they don't really understand breast cancer. And I'm thrilled and hopefully am being helpful. So.
Well, I really appreciate your openness and your thoughtfulness, because it will make a difference. I think that we want to all do the best we can, but when you haven't been through the experience that you've had, or other women with breast cancer, we need to be educated. We need to understand. So I appreciate you.
Thank you. Yeah.